Okay, so I'm going to use Bon Vital massage cream here, and with this technique that we're going to use, you can get something that's a little bit more oily, because I'm actually going to do some cupping so you can see that. So I'm just going to put some lotion kind of all around my leg here, and then I'm going to glide up towards my hip bone, right? That's where our quad attaches. So I'm going to pull up and towards my hip bone. And yesterday when I was working out, I felt some tightness along this outside my IT band. So I'm gonna come, you can see it kind of maybe come down there a little bit. So I'm gonna come on the inside, so closer to my kneecap, and go up and down my IT band right there. So if you think of like foam rolling, I like to do this more than foam rolling along the IT band. I think you get just a little bit better of a release. So IT band sits, you got your lateral quad that kind of comes up along here. The IT band sits right on top of it and tries to take over for your quad sometimes. And so we want to get those separating. We want them working on top of each other and doing their own jobs and not working together. So we're going to come across. You can see my leg is twitching there. So that's a fun spot. Let the nervous system just kind of work that out. And anytime we have some tightness or you see kind of the nervous system feedback, and I'm not sure if you can see it kind of twitching or pulsing, that's the nervous system just kind of working with your muscles and trying to prevent injury. So it's thinking like, oh, do I want to create a cramp to stop this movement, or do I want to keep letting it fire and work through? And so we're going to kind of overwhelm the cramp idea and try to make it calm itself down basically without causing the cramp. And I'm just going to work my way down here. Now I'm pressing fairly hard, but it's enough that I'm still breathing through it. I'm not causing so much pain that I'm like, like I want to run. Granted, it's kind of like, can you tickle yourself? When you're doing self-massage, it's hard to create so much pain that you're doing that, but you want to be able to breathe through it. So here's another spot. My foot is twitching because it's not happy. My quads are pretty tight. So I'm just going to hold it here. Let it calm down. When you're working with the nervous system, you've got to be calm and patient. So it's not a quick fix like we always want. You just got to kind of hold it. So you want to hold it in a way that you can get comfortable, right? So my shoulder's relaxed. I'm pushing with this hand, and my right hand is the tool. So I'm not going to create like strain in my shoulders with this. And we want to be able to kind of be in a position that we can hold it for a while. So I'm going to hold it here. And then as I kind of feel it soften or relax, I'm just going to kind of wiggle along the fibers. So I've got a little bit of a knot or tightness there, and it's almost like if you had a hard piece of butter and you wanted to just melt it down into your bread, but instead you're using your fingers. So you're using the heat and your own circulatory system to bring blood to that area and some feedback to the fascia and the nerves, and then you're working all those systems together to relax the muscles and reduce some tightness. Okay, so kind of just worked on a few spots here. So now we're going to get the cups out. I'm actually going to get a little bit more lotion here. Now, lucky for you, I have nice pale legs. So I don't know if you can see, but we're getting some blood flow. I got some pinkness going on. Now with the cups, these are just silicone cups. We are gonna start down towards the bottom and you just squeeze it together and then let it open on your skin and it lifts it up into the cup. And I always start farthest away from the heart and then move towards the heart. So with the leg, we're gonna start towards the knee and we're gonna come up towards the heart. Now you can go away from the heart, but I just like to zigzag. So we're gonna go across and you can see good blood flow happening right away here. And we're just gonna zigzag just to get the tissues lifting off of each other, get the blood flow going in between all those layers. And we're gonna come up the side here. Now again, this is kind of that seam of the IT band and the lateral quad. Sorry, you're getting to see a lot of my leg today. But hopefully this helps you with any quad tightness that you have or knee pain. Because again, the quad comes down and attaches over the knee. So a lot of times if we've got tight quads, that can pull in different angles of the knee, whether it's your IT band on the lateral side or your main kind of quads going up and over and becoming the patellofemoral tendon there. Or you've got the medial quad that comes down and can sometimes pull on the inside of the leg. So we're gonna come up here and then go across. Now you can see how much suction I have because I can lift and pull too. And that just gives a different sensory input to the system by lifting and creating more decompression. I'm gonna hit the medial side. Now I don't have much tenderness on the inside of my leg. Most of my tightness is coming straight down and then on this lateral side. Okay, so you can see I've got my leg nice and red. And some good blood flow going there.